Good afternoon, everyone, and thanks for joining in. I'm Ellen Mason with the California Medical Association, and I will be your host for today's webinar, which is the final installment of the Data Exchange Explainer series, Qualified Health Information Organizations Overview and Data Sharing Readiness Planning. Please submit any questions that you have throughout the presentation by using the question box in the control panel, which is located on the right-hand side of your screen. We will go over questions at the end of the presentation. Today's presenters are Jeff Nguyen, Senior Director of CMA Physician Services, and Rosh Singh, Chief Technology Officer of COSAVA. First, I will turn the presentation over to Jeff.
Thank you, Ellen, and thank you everybody for making time today. Like Ellen said, it's our last installment of the Data Exchange Explainer series. So for those who have stuck it out with us for all 6, I give you a virtual badge, your awesomeness. And those who may miss the other ones, they are archived and ready for you to view at your leisure. So let's get kicked off. So this is me. I've been supporting the Data Exchange Framework project for almost a year now, and really appreciate all of the questions and all of the input and insights that the audience here has given me, as well as offline during one-on-one sessions and email interactions. So really learned a lot from the physicians and many other organizations that support physician practices. So I'll give, like Ellen mentioned, we'll give a little talk about QHIO updates and some of the planning for the next 2 years. And also we'll have Rosh Singh from COSAVA as our guest speaker today. So really excited to have Rosh here speak on about what this QHIO thing really looks like and what it could look like in your practice. And so hopefully it makes it more real to you and also able for you to pepper Rosh with lots of questions. He loves them, so don't be afraid. All right, so once again, there's multiple ways to give us feedback. Today's Q&A, we'll have a webinar survey as well, a link after our webinar ends. We have our DxF questions inbox, which we're getting a lot of good volume lately. It is towards the end of the year, and I think folks are not interested about multiple things about Data Exchange Framework, so we are trying our best to stay on top of it. Usually you get a response within 4 hours, if not earlier, so keep them coming. And just kind of a plug, we'll be sending out a data share readiness survey, part 2. We did one really early in the year. And this is giving us feedback on the Data Exchange Framework rollout, as well how confident you feel for your organization that you're ready to do data exchange, and particularly electronic data exchange. So we appreciate your feedback. That will be summarized and made anonymous, and we will share that feedback to the state. As you know, the Data Exchange Framework is evolving the policy procedures. There are multiple components that are still being developed, and having your voices heard will really shape it to make sure it works for you, your patients, and your community. All right, so today's agenda, we'll talk about QHIOs, and then I'll hand it over to Rosh, and then he'll hand it back to me to talk about implementation. And this is really about 2024 and on. And for those who may have missed a couple of steps and reminders of what you need to do to stay compliant, as well as to get the latest resources for your practice and organization. And we'll end with Q&A. All right, so QHIO is part of the vision for data exchange in California. So I may have mentioned before, this is an opportunity and for all California healthcare and human services providers. So definitely our prime audience here is physician practices and physician organizations. But I want to kind of step back and remind everybody that we're also talking about health plans, hospitals, community-based organizations, and it could be public health agencies like foster care, maybe some organizations that help with shelter, organizations that help with WIC and other services that are for our California citizens. And so all that data, if you think about it, and I believe many know that it really is trying to patch together the complete services for healthcare and to kind of maintain well-being and health for our citizens. So QHIOs, Qualified Health Information Organizations, are definitely facilitators, and really with the technology, with the different participants in data exchange, to really help physician practices and other organizations kind of get onto the network and really start sharing most efficiently. And in many cases, the QHIOs can help with where you're at, or with your current EHR. Maybe you don't have any EHR and there's portal options. So I really want to show that there's a bigger network and also hubs of data sharing, that this is the vision for data exchange in California. So we have been waiting for a few months for the actual QHIOs to be announced, and it was released in about mid-October. These organizations here on screen. And I will have links in the presentation that we shared after our webinar. You can click and check out each of these great organizations that went through a rigorous process, went through a pilot process even to be qualified by the state to be qualified health information organizations. And so you see that there are some county local specific HIEs, but there's also statewide and national-wide organization as well. So for those who are interested in learning more about each of these QHIOs, recommend click on the links to see their websites. And then too, on our microsite, our team has put together a reference sheet, kind of just a high-level at-glance tool, so you can see what each of these QHIOs have to offer. And of course, there are other health information organizations out there that have not earned the Q, but we included them as well, just for your reference. So the role of the QHIO, like I mentioned a little bit before, is really helping support the signatories be on top of the requirements. Many have both technology as well as the people consultation to help organizations understand what the requirements for the data sharing agreement. Of course, there's going to be areas where there's gaps in knowledge to kind of help. So they will help advocate on your behalf as well to address those questions. It's not, from the very beginning, we know that the data exchange framework is evolving. So there's areas such as, what is real-time data exchange? That is at a very high level, and it's not about like 24 hours, 48 hours, but the expectation for each QHIO is to be working with the state to make sure they are supporting organization to be as compliant and knowledgeable of what the current state of and expectations of the data exchange framework and the data sharing agreement. I wanted to kind of asterisk it that physician practices and other signatory types do not need a QHIO to be compliant. Definitely the state and we at CMA support QHIOs and recommend them, kind of like our first recommendation to use as a resource and option for your organization. However, we just want to make sure everybody understands you do not need to use a QHIO to be compliant. And so that's where each organization has different needs. So please, I want to make sure that we're not leaving you with the thing that you have to switch from your current, for example, health information exchange organization work with, or something within your EHR and sign up with the QHIO to be compliant. So there's a couple of dates going ahead. We'll talk more about this after our highlight of COSIVA. So we will kind of cover what those requirements are looking forward. I kind of jumped ahead here. You do not need a QHIO, once again, to be compliant, but very highly, highly recommended if today you do not have a health information exchange partner you're working with right now, and or if you just want to explore. Definitely, like I mentioned, each of the organizations, including COSIVA, has gone through many rounds of discussions and review and can really support being both a technology provider, as well as speak to some of the requirements from the DSA. All right, I'm going to hand it off to Raj to talk a little bit about QHIO and their care exchange services.
Thanks, Jeff. So I'm really happy to introduce you folks to Care Exchange. Most of you may know or have heard about QHIO. If not, we also go by Applied Research Works. Our Care Exchange product, it brings together diverse healthcare stakeholders, providing seamless and timely access to patient health data. So this is the product that we have introduced to support the obligations here in California for our various stakeholders to meet their data exchange requirements. And it really is intended to provide timely access of information to which results in enhanced care delivery where it most needed. But to tell you a little bit more about QHIO, let me show you in the next slide our footprint. So QHIO, as a product company, SaaS company, spans over 20 states, but it has a fairly robust network here in California. We've established partnerships with over 124 provider organizations and health plans, 12 health plans, and all around impacting about 14.60 million lives. These are lives that are being touched on a daily basis, either directly or indirectly through our provider organizations and health plans. To your left, you will see a map illustrating the geographic spread of our contacts. And on the right, you'll see the specific provider organizations and health plans that are integral to our operations. So across Northern, Central, Southern California, you see the provider organizations there, and to the rightmost, the health plans that those organizations are directly or indirectly contracted with. And so QHIO as a product, in the next slide, this is really what we excel at. We provide both the provider organizations and health plans that we contract with a seamless way to transition to value-based care. And it's through our SaaS solutions that are accessible either through our website or through embeddings that we offer in most popular EHRs that deliver insights that are not just about actionable care. It's about that care and information being timely, being targeted, being comprehensive, and ultimately something that can foster trust because it works backwards from a trusted longitudinal health record of patient that spans any boundaries that may have been artificially created because of a specific system you use. So in this particular view, which is used daily by across thousands of providers in California, you see essentially the red dots highlighting the quality and risk gaps that may exist for a patient with the relevant care history there towards the center, and the longitudinal history and encounters there at the right, spanning labs, ED visits, prescription fills, everything that you really need to get a comprehensive view where this patient is today in their healthcare journey. You're able to access that quite seamlessly through patient dashboard. And again, it's a patient dashboard that you can go to QHIO.com to access, or it's one that can be embedded directly within your popular EHR. Next slide. So one of the cornerstones to achieving trust in a view like that, view that has led to high engagement here in California, such that it's used by thousands of providers and their staff on a daily basis, we really had to focus on trust. So this is really the cornerstone of most of mostly everything that QHIO does is providing unwavering adherence to building trust within our ecosystem. And trust, when we use it, it transcends mere declaration. It's an actionable commitment to transparency, unified data, integrated technology, and collaborative ideation. So what we mean is that in our ecosystem, each stakeholder plays a pivotal role. So you have payers that anchor, the groups in financial stability and security. There's the providers that contribute expert care enriched with human touch. There's the health systems that supply the foundational infrastructure for health interactions, both broad and specific. And then at the center of it all are the patients who receive care that's both personalized and empathetic. So this harmony of roles and responsibilities is the bedrock of the QHIO experience. There's a login for each role in our platform. It provides a unified view for each of these constituents, and it in turn guarantees that everyone involved, from clinicians to patients, has essential information and tools to be informed by the healthcare decisions. This is how we transform the disparate efforts that may traditionally be taken by the respective constituents on this slide to a symphony, a well-coordinated care, and then in turn really cultivating a strong, trust-filled environment. In the next slide, we don't stop with just QHIO's standard offerings. This is where, with our new offering here in California, Care Exchange, it's about taking that and scaling it to address the most current needs that are brought to our attention because of recent regulations here in California. And one of them is really about fostering real-time exchange of information. And the way we do this through our Care Exchange product is that we link the stakeholders that we contract with to a gateway, a national network where they are able to accordingly get access to data in real time by querying for it or subscribing to information so that when their members, for example, are discharged or something related, they'll receive timely alerts that will inform them of what they may need to follow up with the patient on either proactively or next time they see them. This platform is really intended to, meet these key things to all in all drive better outcomes. And we do that not by just, giving or exchanging this information in real time, but as we showed earlier, we take that information and really parse it and provide you a rigorous view into the actionable insights that you can distill on the care journey that the patient's on with you. Next slide. So QHIO, as Jeff mentioned, is one of the 9 QHIOs here in California. And here, QHIOs, these are organizations that have attested to meeting essentially or helping facilitate the data sharing obligations of the various organizations in California. And we do this by, exchanging that information first and foremost amongst the QHIOs. So QHIO may be connected to various health plans, provider organizations, providers. Similarly, other QHIOs may be connected to a separate network of provider organizations, health plans, et cetera. And we, by establishing protocols amongst us, are able to let all the constituents that we contract with exchange information amongst themselves more or less in real time. And so we adopt frameworks to do this. So here in California, things like Care Quality or eHealth Exchange or Direct Trust, these are frameworks that we use to establish essentially channels amongst ourselves to exchange this information at scale and in real time. And then there are also national networks and frameworks like TEFCA that support this more broadly speaking. But the additional things that we do for our constituents is that we take essentially this information, this high volume of information on your lives, and we make sure you don't have to parse through all of it to derive the most valuable information or the actionable information. A lot of portion of the CCDAs, for example, could be redundant, and you may just want to focus on the net new information or the specific structured insights from the free text that may be captured by some provider in their encounter summary for this patient. We use most advanced technologies, AI, NLP to convert your free text into structured insights so that through our product, you can also immediately get the insights that you need, not only presented to you in that patient level view I showed you moments ago, but also in more comprehensive ways through specific measures and insights. And then finally, we also take this data and ensure that it meets the highest industry standards as far as data quality integrity goes. So we will take essentially this data and will validate it rigorously by even doing a primary source verification with the charts as they would appear in the respective EHRs. So you can trust that none of the information has been compromised when it's been transmitted essentially between the constituents involved in this network. Next slide. So one of the things, as you kind of get deeper into this, or you may already be aware, with the data sharing obligations here in California comes a data exchange framework. That data exchange framework lists out the operating procedures of the various constituents when it comes to sharing data. And so QHIO Care Exchange not only provides the technology infrastructure to meet those data sharing obligations, but it also rigorously reviews those policies and procedures to make sure we can help you remain compliant with those growing and changing exchange requirements. So as far as the exchange requirements go, you can kind of distill them in two ways. One is that you need to be able to provide real-time data exchange. That's one of the things that is being committed to through the data sharing agreement. And the second is there's specific exchange scenarios within that you need to support. So one is if someone requests an order or referral, then upon completion of that order or referral, you should be able to push the encounter summary out to the requester. The other is if you want to query for a chart from a specific provider, you should provide means to respond to that, to query for that as well as respond to that. And then the last bit is with ADT event notifications or admit, discharge, transfer events. This is essentially providing means to push that information to the organizations where those members may be impaneled or are attributed. So these three exchange scenarios is what we can support within the Care Exchange product, and as those evolve and as the requirements for those change or as new ones get added, we're kind of prepared with our product and its kind of infrastructure to support those growing needs and scenarios. One of the ways, for example, ADT event notifications would manifest within our product, illustrated in the next slide. So there you can see what this would look like. We would subscribe to various entities that these are your members. And so as those members get admitted or discharged from a hospital, you would see that feed or that alert immediately within the QHIO Care Exchange platform. So here you're seeing, for example, this hypothetical patient who has this PCP that's also registered in QHIO. Their patient essentially had been diagnosed because, or was recently admitted because of a fracture. They are yet to be discharged, and you can see additional details and dive deeper into that patient within QHIO or your EHR through just a single click. And so as this information gets subscribed to the various hospitals and entities or indirectly through QHIOs, you get access to the information immediately. You don't have to wait for weeks. You don't have to wait to hear about this from your patient or other care team members. You can get that information through a very simple, easy to digest interface. And more on the interface in the next slide. Really, there's two types of interfaces. One is there's the data sharer interface, and then I'll go in a moment into the data seeker interface. So the Care Exchange product, at least the way we offer it, to meet your data sharing obligations is to give you a means to have visibility to all the other entities and organizations that are querying for your data. So that necessitates us integrating with your EHR or wherever you document your patients' encounters, so that we're able to grab that information more or less in real time when others on this network, national network, query for it. And so we provide you the interface to see essentially that result of that interface that we would establish and digest essentially the information that third parties would be able to as well if they were to query QHIO. QHIO simply exposes an endpoint to other organizations. Those organizations then can query QHIO for information on your behalf, and it will respond if those members exist in QHIO, and it'll respond with the information that they're querying for which is typically a clinical summary or encounter summary on the patient whenever they last visited your practice or office. And we do this by adopting standard protocols, but also adhering to highest security standards. So we're high trust CSF certified product, but we also know that there's a lot of compliance around data that can be exchanged or cannot be exchanged. And so we, in our product, build in rules to help you stay compliant with those. So if it comes to specific data elements that for whatever reason are shared with us, we will either work with you to filter those out or provide kind of best practices to remove those so that you remain compliant with what you're allowed to share essentially through these networks. Next slide is an example of essentially this data share interface. So this is where you can see specific data elements for a patient that QHIO is able to grab from your respective EHRs, not only as it kind of pertains more broadly to the patient's longitudinal history, but also how it impacts specific measures. So this is a key differentiator of the QHIO platform. It not only just provides a proxy to exchange information, it also can take that information and distill it as meaningful, actionable insights. Next slide. The data seeker interface is the second half of this. This is where you may want to request information from other organizations, or you may want to subscribe to ADT notifications within a specific geography of your patients. This is the interface that lets you do that. So you're able to query not only the other QHIOs in QHIO, but also QHIOs that QHIO is connected to, but also the other endpoints and provider organizations, providers, entities in general that are available on those national networks like Care Quality and TEFCA. We provide customizable queries and data filtering options, so you can really not only query in the most efficient manner, schedule jobs that may be relevant, but also parse that information and really hone in on the specific insights that you need to pay attention to. So an example of this is if this is a new patient, you may not know where they received their care, but you need the latest encounter or past encounters that they may have had. We can query for that a few different ways. You can do geofenced based queries, or we can using other proxies identify specific providers that may likely have records for this patient and help you retrieve those into your system, so then you can provide more informed care for those patients. So it's really also designed as a collaborative functionality. So if you have office staff or other entities within your organizations that can facilitate this exchange or help you get the information you need. You don't necessarily always need to turn to a fax machine. You can always log into QHIO.com, and and if we're contracted with you to support this, we can help you receive information in more seamless ways. Next slide, there's the two add-ons that I mentioned earlier on top of the data sharer and seeker interface. One is our data aggregator validations. So this is where we will, so the two are flipped there. So the left box covers the NLP and the right box covers the data aggregator validation. The NLP is the one that's converting the unstructured clinical text into structured actionable data. We use very robust algorithms to do this, because ultimately, if this data needs to go back into your EHR or you need to use it, we want to distill it in the most meaningful way without overwhelming you with a lot of free text. And so our NLP essentially permits that happening. And then the other piece is data aggregator validation. This is program that and certification that we undergo with NCQA annually. It really helps ensure that the data, as we capture it from these respective systems, is high quality. What we've noticed is that depending on the EHR, that information may not always be captured very accurately, or there may be certain data elements that may be missing. Through this validation process, you get a better sense of what the completion, what the data completion is from these respective endpoints, and then whether or not they align with essentially how the provider sees that information in their respective EHRs. So it takes out the guesswork. You can trust that the information being shared through these channels is also complete and high quality. I'm going to turn this back to Jeff, and I'm sure if there are questions, we'll be happy to take those afterwards.
Thank you, Raj. Very, very robust conversation. And I hope the audience gets a feel for more what data exchange looks like, and also the potential of getting some efficiencies, right? Because nobody likes to go to multiple portals and different applications to get to your patient data. Thank you again, Raj. All right, so let me advance this next slide. So now we're on a portion of just readiness. So this is our last scheduled webinar. We're still around to answer your questions, but we really wanted to kind of step back and look at where we are and where we're going with the data exchange framework. And so speaking a little bit about the grant that we've been plugging away at every grant, every webinar we've had in the last a couple of months, is that this grant is ending next Friday. And so for those who are interested and those who have signed the DSA, you are eligible to apply. Applications information will be on the next slide, but I just want a reminder, it ends next week. And then in January, we have the first implementation deadline, January 31st, 2024. We have mentioned that there is right now no published penalties for non-compliance. That includes if you did not sign the data sharing agreement by January 31st. There is still planned a review of what and how compliance monitoring will look like. However, we encourage all those who are due to comply by the end of January 31st to reach out to us if you have any questions. But once again, for the physician practice and organization signatory group, these are physician practice with 25 or more physicians employed. All right, and so between the 2 years, there's some time, right, for everybody else to comply. And these are the smaller physician practices. And once again, that looks like there's some cushion, but if, for example, you would like to work with an organization, QHIO organization like QHIO, it does take time. to evaluate your current technology, what your needs are. There's a process of doing contracting in there, and also process of scheduling time to make all of those changes, and then really getting onboarded and seasoned with the tool. So really want everybody to kind of think through how to front load any of those activities in the next 2 years if you fall in this implementation group right here. So I mentioned about the data sharing agreement signing is still open, and really for a good reason. We still need more of signatures. I want to highlight that group here, physician organizations and medical groups. Although relatively, look, it's great. It's the biggest group of signers with 1,322, but that's not a lot. When you think about how many physicians, let's talk about independent physicians out there in California, drop in a bucket. So this is a little bit of, for me, urgency to really get as many physician practices, particularly to sign up. We break down this number here for those who have for the signers who had self-identified as physician practices. We had 477. There's a little bit of data dirtiness, right? Because it is assigned what type of organization you are. But once again, 477 in the whole state of California, 477 physician practices sounds way too low. And so we're doing as much best we can, one-on-ones, emails, group meetings. So we're available here to really reach out to individual practices. And if you have a friend, a peer that has not signed in, has questions, please refer us to them. We really want to see these numbers continuously move up over time, and really before there's any type of negative consequences for not signing the GSA. Once again, that portal to sign in is still open, and there's a great, if you go to the upper right help button, it'll walk you through how to sign it step by step. All right, so I'm done beating you guys over the head with this. Resources. So we at CMA are grantees for outreach and education, and we've developed a lot of these cool resources for everybody on our microsite. And so we encourage that everyone who has not seen all of the webinars, check it out. I think there are maybe not all of it are applied to you, but I definitely recommend reviewing the first two, where we cover the data exchange framework overall and also the legal frameworks behind them. I know many practices give us feedback about concerns around patient privacy, so we'll cover in depth. The second one we covered in depth a lot of your questions. If you are not yet signed up for the weekly updates from CDII, who is overseeing the implementation of the exchange framework, I really encourage you to sign up with this website here. It's a quick, short email each week to say what's new, what's happening, what's available online for basically with signatories across the world. Right? So it may not always be for physician practices, but it's good to see what and have access to all the latest and greatest from the state around data exchange framework. And one of the commend the state for this. They're very transparent about their process, about building out these policies and procedures. We're on top of it to make sure, and my leadership is also on those committees to make sure that we are on top of it and represent physician practices as well during those planning meetings. And they're all public, so you can look at the meeting recordings as well as the meeting presentations. It gives you a little bit more insight about what it looks like as well, particularly the policy procedures being developed. And lastly, once again, a plug for our microsite. It is free for everybody, CMA members, non-CMA members. All right, and I want to highlight our HIE decision guide. Once again, it does have high-level descriptions of the QHIOs in there, as well as non-QHIOs that you may be interested in working with to do electronic data exchange. All right, so that is the end of our scheduled programming. We'll open it for question and answer.
Perfect. Thank you both. We have a few questions that came in during the presentation. The first question, who pays for the COZIVA embedded interface?
So COZIVA Care Exchange for the pilot or initial kind of release would only require you to sign a data sharing agreement, list COZIVA as your QHIO in your QHIO onboarding grants, and just sign agreement with us stating you'd like to use COZIVA Care Exchange for the specific stated purposes it fulfills. But beyond that, there aren't any additional costs for the beta. In subsequent years, there may be annual maintenance cost, but it should be nominal. And I think if the question was also pertaining to specifically the embedded app within the EHR, so if we're already supporting that, for your EHR, then there would be no additional cost. If the embedded app is something that isn't supported by your EHR, we would need to discuss the effort to get it incorporated.
Thank you. Next question. Can a patient opt out of sharing their data and somehow indicate that in the EMR record?
So I'm not sure if Jeff, you want to take that, but most EHRs do support that, and accordingly, the data that we're then able to access through their APIs is restricted accordingly. So depending on which EHR you use, there should be the means to preserve kind of the patient's consent around the information there.
Yeah, I paused a minute to see if it was for a COZIVA and specific question, but I think Arash, you're spot on. And we covered this in a couple of webinars, and there is opt-in, opt-out. It may look a little different depending on your EHR. But most EHRs do have a built-in tool to record opt-in and opt-out for data sharing.
Great. Next question. Are large EMR systems required to provide some type of data exchange access?
So broadly, and may have Ross talk about the technical stuff. And for the EMRs that are the ONC certified, there was a little picture image that Rosh had up there. They are built to do data exchange. So it may be something in the background in your EMR that you didn't know that was possible. So really recommend reaching out to your EMR account manager or some type of representative you speak with most. I've done this with a practice that I've visited. They have Practice Fusion, and right then and there we called, and we were able to kind of navigate to their data sharing module and what was already out of the box available. So once again, it is for all the certified EMRs capability that is required. And it just takes a little bit of clicking and asking to find it in your EMR.
Yeah, and you may want to, talk to EHRs on the specific use cases they support for the exchange. So most of them are on these national networks like Care Quality, and they, respond on a regular basis to treatment use cases. So if you're querying for data because you need it for treatment, most EHRs, without respond. But the data exchange framework here in California extends the use cases to payment and operations. And those two use cases, the EHRs may not by default share data for, so you may just need to talk to your EHRs about that.
Thank you for that clarification, Raj.
Next question. Would COZIVA apply for grant funds to support a small practice joining Care Exchange?
Let me answer that question, Raj. So I think I want to say as a QHIO, and there's so the QHIO, there's a grant type called QHIO grants. So COZIVA is now part of the offerings in that grant type. So for a practice who applies for a grant, you have two options: the QHIO pathway and the technical assistance pathway. So if you select the QHIO and you say COZIVA, you're basically supported all the way through your application process. And QHIO and COZIVA, and or to select the QHIO that is chosen, will support the implementation. The technical assistance pathway, you can still pick COZIVA, but you will not get the support from the grant team through the application process. The pro is that if you're requesting to work with the QHIO, the COZIVA, and do something else with those grant funds, the technical assistance pathway allows you to do that. For the QHIO pathway, once again, it's only for getting onboarded with the QHIO like COZIVA, nothing else. So it's a little bit more straightforward path, and you get a lot of assistance from the grant team to do that.
Will there be further grants available for smaller practices with deadlines of 2026?
As of now, CDII has not said that they will be having another round. The latest that we've heard from the state is that there's a good volume of applications coming through, and a high likelihood that they will distribute all of their grant funds. So it was a total of $47 million, and if the third round still had about $36 million left over, and they're on track to award all of it. So if it does result that it does not all of it distributed, the state will consider having another round. But I'll tell you right now, don't bank on it. Please get your application in. And I think the just going the exercise and walking through it and see what you need is a great way to say, is this for me? And second, the funds, you have 2 years to spend it. So it's better to have the funds now and say, I'm going to take the first 6-8 months and really figure out exact vendors I work with. You can say you need you want to work with QHIO, you want to do some EHR upgrades. You don't need to be more specific than that, right? So there is leeway even after getting the grant funds to decide the final vendors you want to work with and your timelines. So there's no real harm to doing the grant right now. So I really encourage those who are interested to sign up today.
My EMR management says that they don't have plans to implement anything soon. What can I do?
All right, so Ross, you may want to add in from a COZIVA point of view. So we've talked to many practices that are in that situation, that they either their EMR says we don't support any data exchange, so let me be more specific, is actually saying we can't send data to, for example, like a COZIVA care exchange and say these are my 3,000 patients, and that if there's any information that is available in this health information exchange, you get access to it. There's some EMRs who can't do that. So that's one. Second, there's other EMRs who say we can send the information, but we can't receive it back. So the option that I've heard health information exchanges and most of the QHIOs offer is an online portal version. And so that works for the second scenario where you can send data out. The first scenario where they can't send any data out, there are some workarounds, but there will be some cost around trying to extract that information out of your EHR. I'm being very general because it'll be case by case what it will take. The first one, you can imagine, the first scenario will take a lot of coordination, and many practices, it may not be feasible to do that and maintain that type of kind of report data pulling out of the EHR into information exchange.
Yeah, I mean, from our perspective, we would, so if you're using a certified health information technology, then it's likely that they're using things like FHIR and CCDAs, and you could connect us to those appropriate gateways with your respective EHR to get that information. And then, we have a few ways of doing this. We can establish a proxy with the EHR to support that real-time demand, but provide a shelter because these networks or kind of queries can be quite overwhelming. And so we would handle the edge kind of gateway to support the timely patient matching to the patients that are being queried for, seeing if they belong to your organization, to some other organization, and if they belong to your organization, then rerouting them to the appropriate proxy so that we can fetch the results on that patient in a timely manner and respond back accordingly to the participant that's been querying us for that patient's record. So all of this more or less happens in seconds as opposed to minutes or hours. So we provide the technology or infrastructure to make that happen, but it does require us to figure out how to connect to your EHRs to support subset of those queries.
Yep. So I'm going to connect a couple of questions. So all what Raj said, I understood like 20% of it. That is why you start now. I kid, Raj. I think I got 50% of it. That's why you start now. If you're really interested to do data exchange, you see that's the direction for your practice, and or you're seeing that there's an expectation, right? And and I would say this is the new bar that we're helping everybody reach. And so what all the things that Raj had mentioned, those are conversations, meetings with your EHR vendor, and of course, bringing in whoever other partnering QHIO you want to work with. And then that's where, and then what Raj had mentioned earlier about use cases, right? Definitely hear out from the experts, right? What's possible, but we really want you to be equipped and informed to advocate for yourself, right? If it's like the lab capabilities, if there are certain organizations you want to connect with, right? We want you to be informed and have the time to ask those questions, because if you're connecting to a network that doesn't offer the hospitals your patients go to the most, there's going to be reduced value for you. So you want to make sure you're an informed consumer, right? So there is time for those who are smaller practices, but it's like I said, these things take time to schedule. Everybody's real busy, and so we want to make sure you have the time to understand and make the best decisions.
Do you know if smaller EHR monthly fees will increase once live with bidirectional data exchange due to increased queries? This is what I have been asked by solo practitioners and small practices.
Couldn't speak for the EHRs. I don't know if Jeff, you want to take that?
Yes, I've seen different pricing models, and Rashid, if you want to add too, is like where, like I mentioned before, I've talked to some practices and explored with some EHRs like how they price. So sometimes it is by, I'll give you an example, by physician MPI. They charge an extra fee each month to connect to like a national framework. There could be also a state framework I've seen as an option too, and they charge something extra. That's what I've seen that the most common. So back to the question is like, is there an extra fee? Yes. I do not know where that is driven from, to be honest, right? Does that fee go back to the health information exchange that is connected? There are some EHRs that do not did not charge a cost to do any connection. And I'll give you a big one, Office Ally. They've been great partners with us to help us understand what they do, what they can't do. And Office Ally today, they will help you connect to an HIE. And they today do not have a capability of getting data back in. So you will have to go out to a portal to look at the information. However, they do support that right now at a zero to minimal cost to do the connection. So it does differ. So like I mentioned, those people at Office Ally have been really helpful and very generous with their time. And I think many of our audience members are using Office Ally. So it's case by case. Once again, I'm sorry we don't have a straightforward answer for that, but I want to give you kind of the spectrum of possibilities.
Okay, here's our last question. Can you join a QHIO if you are already reporting to an HIE?
Yes, I mean, so this is a conversation you can have with the HIE if your current contract with them covers you, for the obligations under the data sharing agreement. If they won't, for example, be supporting all of the transactions like those pertaining to payment operations or information delivery or ADT, then yeah, it would be in your interest to have that conversation with them or other QHIOs if those services would not be met by that HIE.
Perfect. Thank you both. That's all the time that we have for questions today. We have recorded today's webinar and it will be available on demand on our website tomorrow with a link to download the slide deck. All of our upcoming webinars can be found on the CMA homepage or at cmadocs.org/events. Our next webinar on Tuesday, January 9th is CMS Medicare Updates 2024. Recordings of past webinars can also be found on the CMA website at cmadocs.org/webinars. Contact us at events@cmadocs.org with any questions that you have. Thank you and happy holidays.
Thank you, Alan.